Another common problem that we keep hearing about is tennis elbow. What is that, and what is the treatment available for tennis elbow?
So if you actually, tennis elbow itself is a problem where people get a lot of pain on the outside aspect of the elbow. You have an inside and an outside aspect. Because the muscles coming to the forearm, they start from the outside aspect of the elbow. And so repetitive activities that involve wrist movements can give rise to strain in the muscles, and they all start at one point. So that's where you get the pain, that is the outside aspect of the elbow. It's a common misconception that tennis elbow does happen only with tennis players. It was recognized in tennis players, that's why it's got the name as tennis elbow. But it can happen to anybody, it can happen to, homemakers at home, or it can happen to computer operators, or it can happen to, people who've never even seen a tennis racket. So the pain itself is very disabling, because usually people say, they've got a lot of pain, even if the writing they have got pain, they easily get fatigued, and subsequently, they try a lot of treatments. But the initial treatment itself for this condition is, is actually physiotherapy, and the problem happens because there is abnormal muscle insertion, and there is a degeneration of muscles at that particular point. So the treatment of physiotherapy tends to isolate that particular muscles, and it tends to dissipate the forces there. It can also be treated by means of using what is called as a tennis elbow splint, which again dissipates the forces. But if the pain doesn't get better with all these methodologies, then treatment of a keyhole operation is available, which is an arthroscopic surgery. This is an advanced method of treatment where it can be done on a daycare basis, where the patients get admitted the same day and they get home the same day, where we make small incisions around the region where the tendon is affected, and we debride or clean up the tendon, which gives good results in these patients.